Today we will be talking about health psychology in the backdrop of COVID-19. To start, health psychology is a science that originates from biology, clinical psychology, medicine, social psychology, and psychophysiology. It takes into account the work of clinical health psychologists, social workers, epidemiologists, and public health professionals. This field recognizes that each individual bears his or her personal sense of responsibility for his or her own health, and alongside, the governments also play a significant role, having a sense of their social responsibility. Health psychology came about to delve deeper into the understanding of health and illnesses with the most contemporary psychological knowledge. Health psychology considers two major science-based perspectives. Firstly, the biomedical model of health. This scientific viewpoint treats illness as biological problems with only biomedical solutions. And on the other hand lies the biopsychosocial model of health, which asserts that any illness has a biological, psychological, social, as well as a cultural component. In today's COVID era, it seems crucially important to consider the role of health psychology in understanding, responding, adapting, and coping with the threat of this novel virus. This further necessitates the physiological, psychological, and psychosocial impact of the global pandemic, especially on the well-being of the frontline healthcare providers. The pandemic has brought profound changes in health-related behaviors. According to WHO reports, the COVID-19 pandemic has disrupted mental health services in 93% of countries globally. COVID-19 itself can lead to neurological and mental health complications, resulting in stomach ulcers, stroke, heart diseases, agitation, and delirium. Not just this, people experiencing pre-existing neurological, mental, or substance use disorders are found to be more vulnerable to the virus that causes COVID-19. Today, health anxiety has surged across the globe, with many people experiencing sleep problems, increased substance use, death anxiety, and low activity levels because of their increased levels of health anxiety. Roadblocks that prevent countries from addressing the health challenges are poorly prepared health systems, stigma, and inadequate funding. Lastly, media and public health policies play an imperative role in bringing a change. They should sensitize and promote self-awareness, self-help within the home setting to prevent later strains on the healthcare system. This is extremely critical in the contemporary scenario, as it is needed to understand the short and long-term outcomes of the pandemic, which has impacted a vast majority. That's all for today. Thank you.